Hi, this is Uma Bandarkar, and I just wanted to make a video for this is specifically for women with PCOS. And so, as a teenage girl with PCOS myself, I think I just wanted to give a quick overall background of what PCOS is for those who don't know what it is. And so, PCOS is basically a syndrome, and so it's a constellation of symptoms which can affect women. And so, some symptoms are excessive hair growth, irregular periods. And so, in order to diagnose PCOS, the doctors have to formally diagnose it through the Rotterdam criteria. So, one is absent or irregular ovulation, the second is cyst on ovaries, hence the term polycystic ovaries. And then the third is irregular periods. And so, normally, women with PCOS will have to have at least two out of the three criteria in order to be formally diagnosed with PCOS. And so I think it's really important just to expand awareness for PCOS because there are many women who are facing it and it's affecting a lot of women of reproductive bearing age. And so it's really important to shed light on the topic because a lot of women face this problem. And so I think one thing to point out is in order to help manage your symptoms of PCOS, the first best thing is to start an anti-inflammatory diet. And so what that means is basically to incorporate a lot of whole foods like fruits and vegetables, legumes, seeds. And so even a lot of the times I've heard that it's important to incorporate animal products because it has a lot of nutrients and amino acids which can help kickstart your period if right now you're not experiencing a period, and it can also help benefit your periods. And so it's really important to have a diet that's whole foods. And so that means no refined sugars, no junk food, none of that. You can have it in little, from time to time on your birthday or something like that, but mainly just incorporating whole foods like fruits and vegetables. And so another thing would be to try to a lot of the times women with PCOS resort to medications like metformin and birth control, but all that does is just mask the symptoms, and then later on you'll be experiencing other symptoms which can be even worse like miscarriages because you didn't try to resolve the problem from the outset. And so it's very important when you have PCOS to try to get down to the root cause of your PCOS. And so the root cause could be a variety of things. The root cause could be when you go from birth control, a lot of the times when you come off it, you experience missing periods for a few months. In order to get your body ovulating again, you have to, go through the whole diet, trying to sleep early, trying to do some breathing techniques or something to relieve your stress, trying to make sure that you get in your exercise, even if it's 30 minutes, 20 minutes, an hour, whatever you do consistently. You can also try varying the exercise types to make you interested in it. And so, in addition to that, that one cause would be birth control. And then another cause would be inflammatory PCOS. And so, a lot of the times you hear that with a woman with PCOS have low grade chronic inflammation. And so, that's really bad for the body because it can cause women with PCOS to get more stressed than normal women without PCOS. And so, it's really important to incorporate stress relieving techniques which can kickstart your period and really help you get regular periods. And so a lot of the times women with PCOS will have irregular periods. And so a lot of the times a famous strategy is to include seed cycling. And so what it is just cycling seeds like pumpkin seeds, sunflower seeds throughout your diet, and you can find more on it on Google. And so it's really important for women with PCOS to have irregular periods because it can help regularize your cycles and shorten the span between your cycles. And so if you're trying to achieve the regular cycles, you should really try doing seed cycling. And so some books that I would recommend are some famous authors that I know are Lara Briden, who has the Period Repair Manual. And so she goes through a lot of extensive details about what PCOS is, what are some natural what are some natural solutions to PCOS, and on, and it goes on and on about the topic for those who are avid readers and who want to get a lot of detail. Check out the Period Repair Manual. And another one would be the Woman Code, which is by um, the Woman Code, which is by Elisa. And so Elisa is basically she's the person who came up with My Flow, and so she goes into a lot of detail about women with PCOS who go through women, not just women with PCOS, but also women who experience a lot of things like menopause, and how to safely go through it and how to feel good, how to feel your best. And so you should really check that out. And Elisa VT, who is the founder of MyFlow, has a lot of other books, so check her out on Google. And so I really, and also another thing I want to talk about is just mental health. And so a lot of the times mental health is not really talked about, and it's kind of kept, it kept hidden because a lot of the times women with PCOS are scared to speak out about their issues. And so I really think it's important to have a lot of different professionals. So not only your typical gynecologist, your typical, your typical general physician, it's also important to have a mental coach or someone or some health coach or something someone who can help you sort out your mental dilemmas and all your mental health issues, because it's really important to have a sound mental health. You sometimes it's important to have someone with you who can help sort your problems. And so having a mental health professional, he or she might introduce you to journaling or other techniques which can help you cope with stress better. And so that's really important. And in addition, me having PCOS, I decided to reach out to a nutritionist or a health coach who uses holistic health practices like taking supplements, which are basically just supplementing to your diet. And so it's really natural compared to birth control or metformin or pills. And so you should really try getting a holistic health professional like a functional medicine practitioner or a health coach, possibly someone in your area if you want to meet them in person. Or you can try doing Zoom calls, because a lot of health professionals during the trying times of COVID are having Zoom calls or video calls online, and so they can, and even through that they're able to give you the prescriptions and everything you need. So you can try either reaching out to a local person who can help you out with your problems, or you can try reaching out to someone who's in another part of the world but doing Zoom calls or some kind of other video call platform like Zoom. And so, in addition to what I talked about, as mental health is a common stigma and reaching out to mental health professionals if you need the help, another thing that I want to stress out is it's really important to incorporate more fun, more less stress by doing stress relieving techniques like yoga, meditation, breathing techniques, pranayama, anulom vilom. And in addition, not only just mental health, managing your mental health and all those, running thoughts and all those other things, it's also important to have a period tracking app. And so you can use MyFlow, you can use Clue. It's basically, MyFlow is basically you can track your periods, and so you can see how long you went without a period. And so what MyFlow says is it's normal to go within 7 days from a cycle, but if it gets more than 7 days, and that means that your periods are irregular. And so it's really important to solve your regular periods and get a health professional helping you with that as soon as possible. Never wait until the last minute. Always make sure to get a health professional as soon as possible. And so by using a period tracking app like Clue and MyFlow, which also has secret chats to help with, menstrual products that are recyclable or biodegradable, it's really important to also have close friends or some or accountability buddies who can hold you accountable if you don't follow through with your healthy lifestyle changes, or if you fall off the path and you just need a little support or some kind of advice from someone. And so more fun, less stress, more sleep, and also trying to just manage the healthy lifestyle. I know there's going to be a lot of ups and downs, but I know just try your best to think optimistically about the situation, and know that even though PCOS is a chronic illness, it is possible to put your PCOS symptoms into remission, which is very something to think positively about, because as you know, PCOS could have been a result of a variety of causes. It could have been unhealthy lifestyle, which is a topmost cause. It could be some kind of stress, possibly a member who died in the family, and your body just somehow couldn't handle it. Or not only that, it might not even be PCOS. It could be hypothalamic amenorrhea, which is basically something that's not, your brain is not connecting and it's not able to get your period kickstarted. And so you might want to check with your healthcare professionals like your gynecologist and see if there are any other possible causes instead of PCOS. It could be something else which is causing missing periods. And so you want to check with your gynecologist. And so just some takeaway tips. Try not to go on birth control, because, as I said earlier, it only masks the symptoms and it will not recover. And it basically, once you keep going on birth control, it will basically make it harder for you to get your periods back and to help your body heal. And so it's important to turn to holistic health professionals who will help use natural lifestyle modifications in order to get your body back on track for fertility, for regular periods, or just for health, mental and physical health. It's really important to just focus on what it is, what's in the present, and try not to dwell on the past. And try to manage, try to keep track. Some ideas would be keeping track of your stressors by doing a journal, whether it be just journaling, like, what are some things you did today to mainly have fun, to lower your stress? What are some stressors in your life? And, journaling is a really good tool to be able to find out how you're feeling today and to connect with your mind and your body. And so it's really important to turn to safe practices. Do not self heal. Try to not turn to negative things. Try to surround yourself with good people. Try to think positive and think that no matter what struggles you're going through, it's okay to display your emotions, no matter if you're feeling angry, whether you're feeling sad. Never try to bottle up your emotions. Try to talk to a close friend, a close parent, a close relative, whatever it may be. It's really important to speak out and not keep your feelings hidden inside, because as you know, as a PCOS survivor myself, I know it's very important to reach out to whoever can help me and trying my best to just manage the symptoms of PCOS, because something that's very important, it's kind of like a roller coaster. There's ups and downs, but no matter what, there are other people who have PCOS who are going through similar problems as you. And so it's important to connect with that. Possibly try going on a PCOS support group on Facebook. Some people who you can try, there's Kim Campbell. And so she's basically a person who has PCOS herself. She resolved her PCOS through health, through diet foremost, along with other lifestyle modifications. Like, she went through a functional medicine practitioner. She got some lab tests done to uncover her root cause. And from there, she was able to get regular periods from many years of absent periods and fertility issues. And she conceived her son naturally. So that was a success for her. And so Kim Campbell has a variety of programs. First of all, she has a 30-week program, which is basically to help women with PCOS just get their bodies back on track, introducing breakfast first, then lunch the next week, then dinner the next week, and then incorporating 3 PCOS meals a day, as well as having a supportive community. So she has a private Facebook group for that. She also has a 10-week program to delve into a variety of modules like stress, exercise, diet, a lot of other things. And also for sugar addicts, she has a sugar module to help you wean off sugar slowly. So she has a lot of different programs. You can also have Elisa VT. She does one-on-one coaching. You can reach out to functional medicine practitioners, gynecologists. You can reach out to holistic health practitioners, whatever it may be. But it's really important to resolve your problem by just thinking positive, reaching out to doctors, having a supportive doctor team, reaching out to whoever it may be, trying to make, and just to reiterate, more fun, less stress, more sleep. And also just trying to manage an anti-inflammatory diet, more fruits, more vegetables, incorporating animal products wherever it may be. Or if you're a if you're a vegetarian or a vegan person, trying to find some recipes online that are geared for women with PCOS. And so that's really important. Okay. Thank you for listening, and I hope that you were able to take away some helpful tips to help you manage your PCOS or any other chronic illness. As you know, even though these tips are specifically for women with PCOS, other people who are facing chronic issues like gut issues, hyperthyroidism can also use these tips to their advantage. And so I just want to let you guys know that. Okay, thank you. Have a good day. Peace.